Welcome to the second video in a four-part series on faith communities, veterans, and mental health issues. In this video, we turn our attention to the topic of trauma, and specifically to what is often referred to as post-traumatic stress disorder, or PTSD. For obvious reasons, PTSD has been understood as the signature psychological wound among combat veterans. However, as we mentioned in the first video, most veterans do not have diagnosable mental health problems. Similarly, having participated in combat does not necessitate that one will later suffer from PTSD. A variety of factors can determine this. Additionally, many things besides combat can lead to PTSD, making emotional pain in the wake of trauma an experience that far transcends just the experience of those who have served in the military. As you watch this video, we invite you to think about ways that your community can care for those who have experienced trauma, veterans or otherwise, as well as how providing this kind of care might apply to other sorts of emotional, social, and psychological challenges.
Hello, I'm Father Bill Cantrell. In this second video, we will hear from a psychiatrist, a pastor, imam, and rabbi, as well as from veterans who have had some difficulty in reintegrating into their faith communities after having traumatic experiences. We will begin speaking about the role of faith communities and supporting those who have experienced trauma. The intensity of support that trauma demands can often exceed the abilities and availability of clergy. How can you, as a faithful member of your community, support this effort? In a moment, you will hear from Michael Yandel. Michael faced serious challenges when he detached from military service, and he found returning to his faith community to be much more difficult than he ever anticipated.
Between my return from Iraq in 2004 and my separation from the Army in 2006, I became a very unstable individual. I became a very anxious person, a very manic person, an argumentative person, and then I would become silent and depressed, and the community didn't really know how to deal with that, and I don't hold that against them. I was eventually asked not to come back for a while because I was unstable. Returning from Iraq, drinking too much, struggling with undiagnosed mental illness, and then attempting to find the right combination of medications to treat that mental illness once diagnosed. How can one be qualified to sort of meet the needs of such an individual? There's a legitimate question that I think makes clergy hesitate to talk to veterans, especially veterans they know have experienced some disturbing combat. And it's a question of, I have nothing in my own life that matches this person's experience. How can I talk to them about war? I've not experienced it. And to that question, I just have come to discover that trauma changes any situation, and it changes any relationship. And there's no clergy person on the planet whose experience matches the trauma of the person she's seeking to care for. A person's experience is her own, and the qualification for being a good carer for a soul isn't uniformity. It's the desire to learn something about that person. It's a desire to try to see the world through her eyes and try to help her reckon with her own world and her place in it.
I think we need to educate our communities about what the legacy of a trauma is, both a personal trauma and a communal trauma, and then also to understand what can restore the rug that was pulled out from under their feet, what can restore some kind of balance, some kind of meaning, and some kind of connection, because that's what trauma interrupts, is the normal narrative you have that things are going to be okay, that if I do this, this will happen. If I get on the subway, I'll get to work. I think also we have to respect the difficulty of survivors of trauma in returning to the structures that the religious institutions that they were a part of. It's not just anger at God or anger at the tradition. It's a real. They've really been thrust out of a secure narrative. One couple in one of my groups say that they were Orthodox Jews and now they're food Jews. The way they observe is by hosting huge meals on the holidays, and they don't step foot in the synagogue since their son died. And that's understandable. I think the only way it will change is when the community and the liturgy and the sermons all address the needs of bereaved people and groups and workshops, whatever. And so their narrative becomes a part of the community's narrative. And I'm sure this applies to veterans too, that they need to be acknowledged for what they've experienced and not just tolerated, respected for having a certain journey that others may not know very well. The key to visiting the sick in our tradition, or helping people who are suffering, is sharing the vulnerability, not the diagnosis and not the experience, but the vulnerability that we all have, there by the grace of God go I. Also, ironically enough, you shouldn't treat them as people who have been through trauma. You should treat them as fellow human beings who have the same needs that you do of fellowship, of inspiration, and of security.
One of the particular instances that comes to mind of trauma in relationship to a congregation occurred a number of years ago with a family who, through a horrific set of circumstances, lost their daughter. That family continues to tell the story of the loss of their daughter and has even taken the time to document in a small, privately released monograph the story of trauma and healing through the body of Christ.
And in some ways, we're reaping the fruit of that terrible thing in that she came to present, she and her husband both came and presented her book, and she spoke about grief and stages of grief and how hard it was on the marriage and how it was for the other siblings. And she documented her story in a way that is directly now helping a family whose son was killed in a car accident last June. So she and her husband meet privately with this couple who's lost a 25-year-old son. So the sufferers become the experts, where there's maturity and growth.
When you listen to Iraq veteran Michael Yandel's story of rejection by his faith community, what were you thinking? How might you talk with someone about a traumatic experience, even if you find it difficult to relate? Pastor Poole and Margaret Frothingham described a family who experienced trauma from the loss of their daughter. This horrific event tested them in many ways and has now evolved into the offering of their own experience in the service of others who grieve the death of a child. This hard-to-imagine trauma and sense of loss has given them an understanding from their own painful experience, which has proven a great comfort and encouragement to others. What other examples can you think of where the suffering of others has shaped their ability to offer a truly empathic and comforting ear to those in need? How might this inform your community about its internal resources for those who enter your doors looking for a welcoming spiritual home. Now we're going to hear from Matt and Callie Barr. Matt served multiple tours with the Marine Corps in Iraq. When Matt and Callie tried to reconnect to a faith community upon his return from deployment, they ran into some challenges, and the unaddressed loss that he experienced during combat continued to linger.
All this death, we lost 20-some guys in my first deployment, and you don't really get time to think about that. We never went to a funeral. We never had closure. We never saw them buried at home with their families, so we didn't have time, and it wasn't like they were gone.
I don't think you ever really had time to, well, you don't have time to grieve, and part of that's because you're in a combat zone. That's how you survive. You need to go on to the next thing. You need to finish your mission.
So to go from just nonstop training, going from the deployment, we went right into training again, and on to our next deployment. We didn't really have time to process all that happened on our first deployment. I got a job of personal security for my commanding officer, and so during deployment he was killed. I failed, which, as Marines we don't fail. So I've had people tell me there's nothing I could have done, and there really wasn't. It was in the middle of the night, and it was pitch black, and we stepped on an IED, and he took the blast, basically, and I was just, knocked out and fine. I was fine. Physically there was nothing wrong with me. So I hated God. I knew he was there, but I hated him.
And then I think you questioned too, why am I still here?
Yeah.
Right, why, if I'm believing in God, why is he saving me, but he didn't save this like your commanding officer, this great man who was an inspiring leader and had children when we didn't have children. And so you're questioning, what is my value? And does God really know what he's doing?
Yeah. Since then, we've been trying to find, and we've been to a lot of different churches, a lot of different places, and, the only place really that I've found that I can share my story was at the TBI clinic. We had war groups where we brought in, other warriors that had the same experiences. They did bring a chaplain in there just to see how kind of we get a feel for it, and everybody really appreciated his input and his insight and, his understanding. And, I think for a chaplain, a pastor, clergymen, they're the experts. They're the experts, are supposed to be the experts on God. That's what I think of when I think of them. So when I go to them and to share my story, I feel like I'm sharing with an ambassador to God, I would say. So, I expect them to, I guess, have,
Insight?
Yeah, insight to, the man himself upstairs, I guess. I don't know, I don't expect to be blessed and, okay, I feel clean and, all my sins are forgiven, but I feel like, okay, I'm in a good place, the weight is lifted off a little bit. The biggest thing that, I don't know, a lot of these guys that go to war struggle with is, will God save me because I've killed people? I committed these great sins, so am I going to be saved? And so they want to stay away from churches because, I don't know that there is a chaplain or there is somebody that can say, yes, you can be saved because, God will save you, because you even though you did this great sin.
In the Vietnam era, unfortunately, in 1968, a new edition of psychiatry's diagnostic guidebook was published, the DSM, and it didn't include any trauma-related diagnosis in it. It was really bad timing because it was right then that the Tet Offensive was happening and American service members were beginning to return in large numbers from Vietnam in what was an increasingly chaotic war situation. As it happened, a minority of those returning veterans began to organize in ways that were actually opposed to the Vietnam War in a group called Vietnam Veterans Against the War. They began to ally with sympathetic clinicians who also were opposed to the war. And they began to participate in what they called RAP groups in the New York offices of Vietnam Veterans Against the War. And there was a set of clinicians named Chaim Shatan and Robert J. Lifton who began to meet with these young returning veterans. A number of writings emerged from that, including a powerful and important op-ed in the New York Times by Dr. Shatan on May the 6th, 1972, that was titled Post-Vietnam Syndrome. It was an op-ed, it wasn't a clinical journal article, but Shatan described a couple of veterans who experienced what we would now describe as PTSD. They were suspicious of others. They were, always looking around, checking surroundings. And he said, we might label this something called post-Vietnam syndrome. And here's the different signs of post-Vietnam syndrome. And what Shatan wrote about was things like feelings of alienation, continued doubt about ability to love others, feelings of victimization, and feelings of guilt and shame. Shatan said in this op-ed, sometimes veterans will ask, can we atone? How do we turn off the guilt? These are profoundly moral questions. Now, this got a lot of attention, and people began to pay attention to Shatan and to others, and they began to say, we actually need something within psychiatry's diagnostic guidebook that reflects this experience. So they began to talk to the people who were in charge of that process, and the process took almost 10 years. And what eventually came out in 1980 was the diagnosis of PTSD, or post-traumatic stress disorder. Now, it's unfortunate in that context that when PTSD came out as a diagnosis, it had language that mostly described PTSD as a fear-based disorder. But what's increasingly being recognized in our time is that PTSD, these kinds of responses, aren't always mediated only by fear, although that might be part of it, but are also mediated by other kinds of emotions, by anger, by sadness, and especially by guilt and shame about things that were done or seen in war that are hard to know what to deal with as once returning from war. Who have I become having done certain things in combat, or having participated in certain things, or having seen other people do certain kinds of things? And that the term for that is increasingly moral injury. But it's important to know that moral injury is not a new discovery. It's a rediscovery of a very old realization that really is with us from the very earliest descriptions of combat trauma.
Dr. Warren Kinghorn speaks of the aftermath of the Vietnam War and how many veterans allied with sympathetic clinicians in what were called RAP groups. One outcome was an article about post-Vietnam syndrome. The signs and symptoms noted in the article were feelings of alienation, continued doubt about the ability to love others, and feelings of victimization, guilt, and shame. Can you think of ways in which a faith community might be suited to respond to these symptoms? You also heard from Matt and Callie. Matt lost his commanding officer who he was assigned to protect. He felt responsible and lives with the belief that he failed. What ways might you offer support, and what might you want to avoid in offering support to someone in these circumstances? Faith communities are ideally positioned to respond and make meaningful contributions to the healing and recovery of veterans carrying the wounds of moral injury. How much room does your community have to allow the weight of this burden to be shared? Do you have resources to provide veterans with spiritual care and support? If so, in what ways can your community make sure these resources are available?
The presence of a caring faith community can be powerful for someone who has experienced trauma. Yet it can be hard knowing exactly the right way to respond. We invite you to think about the following questions to discern different possibilities within and outside your community for providing care to those in need. Consider as a community, how do we offer hope to persons who have experienced trauma? What are some of the resources inherent in our practices, beliefs, and programmatic services? Secondly, consider, are there any aspects of what we do as a community that may cause persons with trauma or mental health problems to feel alienated? What are those things? Is it possible to do things differently in any way? Finally, consider what resources are available beyond our community to help persons with PTSD and/or other mental health problems. What local resources exist? Who knows about these resources? And how can you connect people in need to mental health services?